I'd say the first time I tried acupuncture was around 2 seasons ago, so 2 years ago. It's a positive thing that we get access to it. Me, in my position, I do quite a lot of bit of running, long distance running, so my back tends to lock up and seize up. So I find that the acupuncture helps release it and gives me more mobility on the pitch. Yeah, I'm not too sure. I'm always willing to try new things. I always trust the physios, so see what their views was on it, and they advised me it can help, it might not help, so I was just willing to try it, and I found out in my case it helped me quite a bit. Yeah, definitely. I always ask for acupuncture if my back's feeling stiff and locked up or tight, and I think that it will help. So I'll ask the physios, and they're always happy to do it for me. Yeah, definitely try it. See how it is on the body. If it helps you recover, helps improve your performances, then why not? I feel, like I say, it eases my back up, it releases the tension, and straight away I feel a difference. It feels better.
We've got a 23-year-old professional footballer here who's got a long-standing history of low back pain, has had some previous injuries to his left and right hamstrings, as well as some contact and non-contact injuries to his ankles. On Saturday during the game, Curtis pulled up reporting a sensation in his right hamstring around the mid-belly towards the outside of his leg, so towards his biceps femoris. He immediately removed himself from playing, and we're now 4 days post-inciting event, so post-injury. The rehab's been going really well. He's got normal walking patterns, so he doesn't walk with a limp. From a gym point of view, we've moved on to eccentric functional work, so he's on one leg as well, and we've introduced some external loads, so some weights, and he's looking at rotational forces. From a field-based point of view, so we've progressed to running, so running in straight lines at the moment, and we increased the pace today. Tomorrow we're hoping to move on to multi-directional work and add in the ball as well, so try to make it more specific to football. We've got 3 aspects of our philosophy which players buy into, and the first aspect is to reduce their risk of injury. The second aspect is to increase or improve their athletic performance, and then the third aspect is to help them to be able to tolerate the demands of the game. So if an exercise doesn't reduce your risk of injury, doesn't improve your athletic performance, or doesn't help you tolerate the demands of the game, then it's simply not included. So we don't have a huge vast bank of exercises that you might do differently and this guy might do differently. We don't have a protocol or a recipe or a cookbook, but what we do is we look at the demands of the game, so being able to run it economically and efficiently.
And I think acupuncture has become, just a part of everyday modern football. I think you see it used quite often from all the clubs I've been at. Certainly, there wouldn't be a day go by probably that I wouldn't see the needles coming off. So I think it's something, if we're going to be moving forward as a medical department, it's something that we've got to make sure we study and know about, and make so that we don't get left behind, and we can give our athletes the best possible rehab, what we can give them really.
There are many proposed models of and theories and mechanisms about how acupuncture works. So one theory in particular, which is based on a Western approach, so an evidence-based medicine approach, postulates that acupuncture modulates spinal signal transmission and the brain's perception of pain through a neurophysiological approach. It does this in a threefold effect. So if we look at the first effect is on the local tissue. So when we insert the needle to give that initial stimulus, what is happening at this stage is that we're causing local trauma to the anatomy around that region. This causes a release of calcitonin gene related peptides and histamines, and that's going to cause a local inflammatory response around that local tissue. The second way is through a spinal segmental approach, in which acupuncture helps to relieve pain. So what happens here is, when we get the initial stimulus from the insertion of the needle, it excites A delta fibers, and these are fast type fibers, myelinated fibers, and they excite beta endorphins and enkephalins, and these are chemical neurotransmitters, and they help to decrease the pain, the input of pain, by asking the brain to attend to the needle rather than the actual pain that the patient was experiencing. The third way is through a supraspinal mechanism. Cells within the spinal cord will then communicate with the brainstem, the hypothalamus, and the periaqueductal gray. The messages get sent up to these areas in the brain, and chemical neurotransmitters are sent out systemically, and they are also used to help block the sensation of pain. So you're almost taking your own painkillers, really. Moving on to the hamstring itself, we're going to acupuncture 3 points. So we're going to acupuncture at the top of the hamstring, so just underneath the gluteal crease here. So we've got the glute, just gently popping the needle in, as you see. Then we're going to come down to the middle section of the hamstring, okay, just here, place that just like that, and again all I'm going to do is just a little tap at the top of the needle, so patient, athlete can't feel anything, and then just gently tease the needle in. And then we're going to come down to in between, right down just at the back of the knee here, just pop it onto the crease here, take off here, little tap here, pull that out to here, catch between 2 fingers, and there are my needle points for acute hamstring pain. So acupuncture forms part of a multimodal approach, so we use it as an augment to what the patient or the athlete is already experiencing along his treatment journey. So he might be getting manual therapy, it might be exercise, it might be education, they might be coming off the back of an operation, but ultimately it's the athlete is able to access it if and when they need it. So it's part of a wider program for sure, but it's definitely not the be all and end all. Yeah, interesting concept really. Performance in a lot of aspects is directly related to recovery. So the harder you train, the harder you recover. So the aspects that we've been looking into in recovery have been hydration, nutrition, sleep, and possibly I think acupuncture could certainly play a role in recovery. So it's not unknown for some athletes to come in and access acupuncture the day after a game. They would report more of a sensation of soreness from the game, and it's their preference as well with regards to whether they would access that or not. So maybe it plays a role in recovery, but it'll come down to the patient's or the athlete's beliefs anyway. Well, I guess everything is governed by the athlete, so they have autonomy of care, and there's other reasons why somebody might not be appropriate for acupuncture. So they may have a contraindication or a condition that might not allow them to have acupuncture. Yeah, look, I guess professional footballers are exactly like every other person that's out there. So they're definitely open to the idea, and I guess, look, if you've got a phobia of needles, you've got a phobia of needles, and that's regardless of whatever your occupation or profession is. Yeah, I guess number one, we got to define the outcome of acupuncture, and that's an increase in function and a decrease in their perceivement of pain. So be you a mountain biker, rugby player, CrossFit athlete, gymnast, so it's about looking to what we're looking as an outcome from acupuncture.
The first time I ever experienced the use of it was, well, probably 16 years ago, playing for Leeds United. We had a Champions League quarter-final against Deportivo La Coruña, and the Saturday before the Tuesday evening game I had a bad effusion on my right calf, and as I said, I'd never come across acupuncture before. The procedure obviously was just ice, rest and try and do it the normal way. We got to Tuesday morning, mid-afternoon, and I was still struggling to make any progress. And as physio at the time, Dave Hancock, who went on to be physio for England and New York Knicks, the basketball team, said to me, "Do you want to try acupuncture?" And obviously it was a massive occasion, a massive game for me. So that was my first experience, and with great results, to be honest. I just remember my hands going bright red as soon as he did it, and I was like, "Is this normal?" Because I was lying on my front, and I was like, then the weird sensation goes through your body and just dispersed of all the hematoma that I'd had around that area. And like I say, the initial reaction was great, and like I say, I managed to play a full game, and to say that was my first experience. I tried every procedure before that to try and get fit, and as I say, I was probably a major doubt for the game beforehand. We had the acupuncture treatment, I went out for a warm-up and felt fine. I didn't really feel anything, which was really strange. It must have just cleared the area so quickly and dispersed of whatever were making me struggle. And as I say, I went on to play a full game and never really had any trouble with it after the game either. So as I said, that was my first experience of it, and a great experience it was.